General situation of the COVID-19 pandemic in the world, especially in the U.S. The COVID-19 pandemic has affected more than 309 million people and caused more than 5.6 million deaths worldwide, and the U.S. is still the most affected country with more than 52.2 million cases and more than 839,000 deaths. The U.S. is currently facing a triple epidemic of respiratory viruses, namely influenza, COVID-19, and respiratory syncytial virus, and vaccination is the best way to prevent and treat these diseases. Some symptoms are common between cold and COVID-19, such as cough, sore throat, fever, fatigue, and nasal congestion, but some symptoms are specific to each disease, such as runny nose and sneezing for cold, and shortness of breath, loss of taste or smell, and pneumonia for COVID-19. The onset and duration of symptoms are different for cold and COVID-19, and the best way to diagnose the disease is to see a doctor and take a COVID-19 test. Cold can weaken the immune system and increase the risk of respiratory infections, and some bacteria and viruses that cause cold can also cause pneumonia. Influenza virus, a common cause of cold, can cause viral pneumonia, and Streptococcus pneumonia, which is a common cause of bacterial pneumonia, can enter the lungs after a cold and worsen the infection. The best way to prevent pneumonia is to use vaccines, practice hygiene, avoid smoking, and seek medical care if symptoms occur. The recommendations for COVID-19 patients depend on the severity and symptoms of the disease. Some general recommendations are to rest and drink plenty of fluids, take fever and pain relievers, use masks and practice social distancing from other family members and pets, to avoid contact with other people and stay at home except for seeing a doctor. Monitor symptoms, and seek emergency care if severe symptoms occur, such as shortness of breath. The duration of home quarantine for COVID-19 patients varies, and according to the World Health Organization, patients with symptoms should stay at home for at least 10 days after the onset of the first symptom and until they have no fever and their symptoms have improved. And patients without symptoms should stay at home for at least 10 days from the date of their first positive test. In some countries, such as the U.S., the duration of quarantine for asymptomatic patients has been reduced from 10 days to 5 days. The duration of quarantine should be determined based on scientific evidence and the conditions of each country, and that the purpose of quarantine is to prevent the spread of the disease to other people, and it should be done according to the prevalence, capacity, diagnostic, and treatment methods, and behavior of the people. If these factors are managed, it may be possible to reduce the duration of quarantine. Still, if these factors are not controlled, it may be necessary to increase the duration of quarantine.
I rock the world with my AI. I'm the best there is, no one's better than me. I'm the king of